introductory stuff. So this is our fourth session out of 8. This one's going to be about cattle health. And then of course we have our whole team here that's making all of this possible. Today we have Elizabeth, so she also works in Extension, and I will introduce her in a little bit. So again, the goals of our webinar, just kind of give an introduction on a very basic scale to the dairy industry and its components, mainly in Missouri, but across the nation as well. And then how do we manage this small herd? Thinking 1, 2, maybe up to 10 cows, but usually no bigger than that. And then just be informative, make it suitable for everyone, whether this is your first cow or your 100th cow. So hopefully everybody can find little bits of information that applies to them too. Okay, and then asking a question, you are more than welcome to use the chat box. It's going to be on the bottom of your screen in that little bar. You can send in your questions that way, or since it's just 3 of us right now, feel free to unmute and just talk away and ask us all the things. If you come up with something after the webinar is over, please email it to me, and I can also get that to Elizabeth if needed. So again, this is me. I think we've gone over this before, but I am the dairy field specialist in the Southwest region. So I do a lot of educational programming with dairy farmers as well as some beef producers, just because that's prominent in my area as well. I do on-farm visits. I've been helping out at the fairs this summer, so that's what I've been doing recently. I'm also on a couple advisory boards as well as fair boards. And my area of interest is just general cattle reproduction, specifically endocrinology, but all of it gets me excited. Okay, so Stuart, if you want to, you can unmute and talk about this with us, but what is your experience with dairy farming and where are you looking to go with dairy? Mainly, what are you looking to get out of this webinar? If you don't feel like talking, you just send it in the chat and we can go over it later.
Yeah, basically I have 35 acres and looking to retire on it soon, but so I was just exploring the possibility of raising a few cows. So
Yeah,
it's kind of wanted to get some basic information.
awesome. And I will let you in on the secret. I am trying to do kind of like a wrap-up tour for our series where we can go and visit a smaller dairy herd. So fingers crossed that it works out, but I am trying my best to get us some on-farm experience.
That would be great, yeah.
Okay, and then with us today, we will have Elizabeth Picking. So she is one of my amazing colleagues that I rely on all the time to answer some questions for me too. She's a livestock field specialist, again, in the Southwest region. She's housed in Howell County. And again, like me, she does serve on multiple different advisory boards. So like soil and water, she's also on a couple different grants. So I'll have you actually, Elizabeth, in a minute, explain kind of the farm stress grant that you're on, because I think that one is amazing, the work that's being done with it, and a good resource, just if anybody here knows anyone that can benefit that or benefit themselves. So sorry for the tangent, but she received her bachelor's degree in animal science from Texas A&M, as well as her master's in physiology of reproduction, also from A&M. And so cattle reproduction is her thing, specifically fetal programming. So how does the environment that the cow is in affect the calf that they are actively growing? Those are the kind of questions and topics that she likes to explore. So without further ado, this is Elizabeth.
Thanks, Chloe. Yeah, and to comment on the mental health and farm stress side of things, there are, some grants through the university, and I know it hits dairy farmers hard, but everybody, and we've actually got some resources to give free counseling services to people. And so if that's something that you're interested in for yourself or your friend or anybody that they're get in contact with Chloe or I, and we'll get you those resources. But that's one of the things that I work on with Extension. And Chloe asked if I could kind of talk herd health, and I will say, for some of the dairy specific stuff like mastitis, I think she's going to talk a little more in depth, just because my background is more on the beef cattle side. And my research was looking at kind of nutrition during pregnancy of the mom and how that affects the calf growing. But I'll certainly talk a lot of our things that apply for all cattle, regardless of dairy versus beef. And then she's going to talk some about mastitis and, kind of focus a little bit on that because it's so prevalent. But Chloe, will you hit the next slide, please? So I guess the first thing I wanted to talk was kind of through the stages and kind of what to look for and what things we might see in illness and things like that. And so if we're talking kind of birth to weaning, we typically should have less than 5% death loss in our herd, which, if we have 2 or 3 cows, that gets a little harder to measure. But, this is when things like keeping our, whatever barn or pasture or lot or however you're calving out and however you're keeping those calves, sanitation and keeping clean bedding, and also good ventilation in those areas is really important. Just an overall disease control. And typically we want to start, if we're going to go and bottle feed, calves, you want to start by bottle feeding the youngest first and then move on to the older, because those young ones just don't have the immune system built up yet. And it's pretty easy to take some bacteria and things like that, or viruses from those older calves, and then transport it to those younger calves that are going to get sick from it. And so making sure that we clean and sanitize all of our equipment, so especially our bottles and the nipples and just different feeders and things like that, is really important to kind of stop spread of things, sickness between calves. And there's some things we can do for them, vaccination wise and kind of in our health protocols. For our newborns, you might want to, and some people inject vitamin E and selenium. And so that helps prevent, if there's a deficiency in vitamin E or selenium, you can see white muscle disease, which is kind of a tying up or issues with the muscle in those calves, and we see it across species, so it's a problem for multiple species. But typically, that's kind of a preventative measure, giving that injection. And some people will also inject like vitamins A and D. So those are kind of just to help avoid any deficiencies that they might have. And then when you talk about that kind of 1-month-old calf, that's when we need to start thinking about Clostridium, which is the same thing as blackleg, if you've heard of blackleg. And you might then dehorn if you're not, if those calves aren't naturally polled. And so, we're letting those calves get a little bit of immunity and grow a little bit before we do some of that stressful stuff to them. And then, of course, fly control is always important because flies will spread disease. And so that might be using insecticides, sprays, or dust bags, or even fly tags, things like that can help. And then, we can also set those calves up for success by vaccinating their moms, and they will then pass, if we're giving them their colostrum, they will then pass some of that immunity through the colostrum. And so making sure that our, adult cows that are calving out are in good health and good nutrition status and things like that is important to kind of set up that next generation for success. Something, a lot of folks will milk out that cow and get that colostrum, and they might save some back and freeze it. And that's great. It's great to have that colostrum, especially when you're in a pinch in the future. But some things, there are a few diseases like Johne's and bovine leukosis that can be passed to the calf through the colostrum. And so, if you end up having a lot of health issues or, especially, and I'll talk about Johne's in a little bit, but, cows that are kind of falling apart and getting really thin and things like that, we may need to do some testing and make sure we're not exposing that next generation to issues. And so colostrum is great, but it also can, if we've got a cow that's got something, we could be spreading it to somebody else. So, and, when we talk about, colostrum, they need to kind of have it in that first, really, the research shows that first 12 hours, because their gut and their membranes, will start to not absorb the proteins and after 24 hours, but we do see a big decline after 12. And so if you can at least get some colostrum in them in that first 12 hours, they're set up better for success. And of course the amount is going to look different if we're talking Holsteins versus Jerseys versus even beef cows, that sort of thing. But when we talk kind of that early age, that birth to weaning them off of milk, the most common illness we are going to see is scours, and that could be bacteria, that could be viral, but it means diarrhea. And so we'll see a lot of calves maybe be lost during that time just because they get dehydrated from the diarrhea. And so, trying to prevent that by making sure our areas are clean and we're not going from older animals to those fresh new ones, those can all help kind of prevent some of those things. So when it comes to kind of that older calf, that 2 to 6 month old, maybe we've weaned them onto feed or hay. And, this is where we start to look at, okay, what kind of vaccinations do we want to do? If we can get them to this point, get them past that 2 months where they don't really have much of an immune system and that sort of thing, we shouldn't have as many problems. Now, I will say, this is where our respiratory illness comes in and things like that. But we can vaccinate for a lot of diseases and to kind of prevent some of those big problems. And so IBR, PI3, BVD, and BRSV are usually in a combination shot. And so getting those covered is a good thing. I also recommend people to vaccinate for leptospirosis or lepto. And usually the combination hits 5 different types of lepto. And lepto is really pretty prevalent in our area. And so it's definitely something that I recommend people vaccinate for. And then also with these young calves, I talked about the blackleg or Clostridium. That's something, again, these young calves I would definitely vaccinate for. You can get, multiple strains covered. And so that's why it usually is in a 6 or 7 way, that type of vaccination. And then, you might look at, okay, do we need to start some parasite control? That sort of thing. And then of course, fly control. And this is a good time to look for any like utter abnormalities or extra teats or things like that at this age. Now, so we're typically going to vaccinate, do 2 rounds of most of these. So they'll have a booster. And you could do it 1 set when they're 2 to 4 months, and then another set, of course, following the label directions on your medication, but for sure giving them that booster so that it helps their immune system be able to recognize and fight off those things. So, this calf is a very obvious respiratory case. Its ears are droopy and down. It looks lethargic. It's foaming. A lot of the time they'll have snot, draining out of their mouth or their nose, excuse me. They just look bad. And I would guess this calf would probably have a high fever, and it's got some sort of respiratory illness going on, which could be, caused by lots of different viruses or bacteria. But this is going to be your kind of most common, scours is a problem for those early calves. And then as they get older, then we start seeing more respiratory problems. And one of the things we can do to kind of reduce the respiratory illness or, incidence of them getting sick at all is to kind of try to reduce stress on them. And so not moving them for a couple weeks after we wean, because they've already got that stress of transitioning to an all food diet versus milk. And then moving them during that time not only could expose them to different viruses and things like that, but also is just another stressor. So trying to minimize the amount of stress while they're kind of in this period of their life, it can help reduce illness. So when it comes to kind of those older calves into up to 2 years old, we shouldn't be losing very many of these animals. We've kind of gotten past the big hurdles, the big areas that we see a lot of death loss, or more death loss. And so the main things we need to keep in mind are keeping these guys at a good plane of nutrition to help them continue to grow and kind of be gearing up to breeding, and 30 to 60 days before we want to breed that heifer for the first time, we can do some vaccinations and booster some of these things like IBR, PI3, BVD, BRSV, lepto, some of those vaccinations, and that kind of helps give them some more immunity in case if you are bull breeding, if that bull is carrying anything that helps them kind of potentially fight off an infection, or something like that. We also, of course, want to continue to kind of keep on a parasite, external or internal, whether it's flies or it's lice or any of our internal parasites. Maintaining that is an important part of it, just because that can drag them down and drag their immunity down. And then, something else we ought to do, on heifers that are somewhere between 12 to 14 months old before we decide to breed them, whether that's through artificial insemination or whether that's putting them out with a bull. What I recommend to people is to do a breeding soundness exam, or which is kind of comprised of a pelvic measurement, which the veterinarian can take the width and then the height of the pelvis, like this one picture, and you multiply those numbers together and you can get the area. And so, a lot of the research shows that they should be at least 150 centimeters in area. Otherwise, we might have issues with her having that first calf. And so this is a time where you can kind of prevent any future calving problems by catching these abnormal shaped pelvises or things like that. Um, and your vet will, might even just say, oh no, there's something weird going on. This calf is going to get its head stuck when it tries to come out. And then you can, kind of make adjustments rather than ending up, having to pull a calf or do a C-section later on because she might have some sort of abnormality. And then another part of this is the vet can go in and palpate the ovaries, and they can see, is she already cycling? Is she close to cycling? Or is she behind where she's not very developed and might not be a good candidate to keep for breeding? So those things can kind of help weed out any of the females that maybe are not going to work well in your herd. So, of course, and Chloe's going to talk some about mastitis towards the end, but it's the most common disease when we talk about dairy cows worldwide. And there's a lot of different bacteria and things like that that can cause this infection, but it's an infection of the teat streak canal inside the teat. And when we talk about, prevention, we really have to keep in mind hygiene and keeping all of our milking equipment really clean, using teat dipping and disinfecting when we milk, and maintaining good clean milking equipment. And of course, I think it's important to work with whatever your preferred veterinarian is to kind of have a protocol when you do run into mastitis, because I would say, any dairy farmer is going to have some incidents of mastitis, and it may get to the point where a certain cow may need to be culled from the herd if they have kind of recurring mastitis problems. Some of the, I'm going to talk about some of the diseases, and some of them we can vaccinate for, some of them they don't have a vaccine for. And so, if you're going through and you start to have some health issues in your herd or things like that, maybe this might spark, oh, I kind of have that. Maybe I need to talk with my vet about, or call Chloe or I or something, and see, okay, this is what's going on. Do you think it could be this? And, so it might just be a, introduction to some of these things, but certainly don't let it overwhelm you in terms of all of these different diseases. But it's certainly something I get a lot of calls about, especially when people have cows that abort their calves or have stillborn calves. We start to think, okay, could it be one of these diseases? So Johne's is one of those that is pretty rampant in both the dairy and the beef industry, and it's caused by a bacteria. And what ends up happening is you'll see these cows lose a ton of weight even though they're eating normally, and they usually will have diarrhea. And then they also might get what they call bottle jaw, or like a swelling of their jaw area. Now, with the bacteria, if you leave the calves on the cow, you can transfer the disease or the bacteria to that calf. And it can also be passed through the milk as well, and the colostrum. And so that's the struggle and why it becomes such a big issue for some folks. And we also see that some of these animals that are infected with it will shed this bacteria way before you see the physical signs that they're sick. And so that's how sometimes you can get in a cow that looks normal and then infects the rest of your herd, and you don't know until you've got all these really sick animals. And so this is one that you can test for, but we don't have a vaccine for it yet. So it's one of those things that, if you're seeing animals that are kind of wasting away or something like that, this is one that I would think of as, hey, let's go ahead and test this animal and see if there's something going on. So, we don't hear about tuberculosis too much anymore. It seems like that's typically an old-timey disease, but a lot of that is because of the traceability, and the focus on making sure that it's not passed, and then also, of course, pasteurization of our milk. So it's a bacteria that can spread, and it's one that is pretty dangerous because it's zoonotic, or what we call, zoonotic means that it can spread from animal to person or animal to a different species of animal. And where we see this, and where we used to see it a lot more in people, was because we consumed more raw milk years and years ago, and less people are consuming raw milk, but we can still potentially pass it through raw milk consumption. Now, the way this bacteria infects the animal is that it infects the lungs and the chest, and sometimes it can infest like the genitalia of the animals and be a reproductively transmitted disease. Now, the strange thing about this one, and I don't worry about this one too much because we've, for the most part, eradicated it, is they don't always show symptoms, but it might be something that we find out at slaughter that they had it. So this is, just one of those things where I think, you know, going from more raw milk to more pasteurization, we've seen less issues with it. But it's something that will always be kind of traced by the USDA and things like that to make sure it doesn't get out of hand. Okay, so now, I talked about getting a lot of calls about stillborn or aborted calves, and this is where I kind of wanted to cover some of the reproductive diseases, and some of these we can vaccinate for, and so that's good. So one of them is brucellosis, or Bang's disease, and it the Bang's disease, typically, so you can vaccinate for this, and a lot of the time your veterinarian will give you, used to be they had those metal tags like are here on the right, but now they've started to move to the RFID electronic tags. And so, this is something that your veterinarian can put in for you when they give the brucellosis vaccine. And it's something that needs to be done in animals like less than 12 months old. So the first year of life, that's when you would vaccinate for this. We don't see it very often because there's been a big push for traceability and kind of tracking this, but it can cause abortions if you have it in your herd, usually somewhere in that last trimester of pregnancy. And it can cause some stillborn calves. And sometimes we'll see the calves be kind of, it's pretty gross, but what we call autolyzed, or kind of broken down and not very intact by the time they come out. And so this is something that, like TB, is also zoonotic. So you and I can get it, and it actually can be airborne. And so if you find a calf out in the pasture, things like that, I always recommend putting some rubber gloves on or something like that to prevent you from potentially getting anything. So another one that is pretty rampant, my office is down here in Howell County, which you can see on that map is the darkest red. Trichomoniasis, or trick, we are the Howell County is the queen of trick numbers in Missouri, apparently, which is not a good thing. But this is a protozoa that will infect the sheath and the surface of the penis on the bull. And it can potentially make these bulls, like, they could have an active infection for the rest of their life. And so basically, anytime they would breed a cow, they'd be potentially infecting that cow, which means that we usually see early pregnancy loss. And so it might even be 20 or 30 days where you don't even know that she was bred at all. And so then you go to do an ultrasound or you go to palpate her to check for pregnancy, and she just seems like she's open. And so if you had multiple animals coming up open and you were breeding with a bull, then you might start to wonder, hey, is he infecting them with something, and they're dealing with that infection and aborting that early calf. Missouri Department of Ag does require all non-virgin bulls and bulls over 24 months to be tested for trick. And this means that, like, except if they're going into kind of the slaughter pipeline, or our buffalo, bison, or some of our exotic bovine, or if they're a virgin bull and they're less than 2 years old. So if you're buying a bull or selling a bull, I recommend testing them for trick, just to make sure that you're covering your bases. But if you're using artificial insemination like we do on a lot of dairy farms, you don't have to worry about this one.
I guess to add in another point on your trick testing, even if you are using AI, those bulls have to be tested for trick before they're even collected in that facility. So if that eases your mind a little bit, if you have any questions, every bull has to be brucellosis and trick tested before they're even allowed to stay in the collection facility. So that's great too.
Yeah, absolutely. And that's why I'm a big proponent of AI, is a lot of these things, we can kind of avoid some of these infections, because they're tested for it, or it's not going to be passed through just the semen. It would be passed from the contact with the actual penis, So just some things, kind of benefits of AI, I guess. Okay, vibriosis, or Vibrio, is another, it's a bacterial infection, and it can also cause kind of infertility or early embryonic death, or that early pregnancy loss. And this is where we might see aborting calves, or, slipping their calves between 4 and 8 months of gestation. But we might not even see the calf. We may not know until she's supposed to calve and she just never calves. And this is one that is usually spread through the pasture in the environment. And it's something that they can pick up from, it can be spread through urine or feces or things like that, from infected cows onto the grass, picked up by the next cow, that sort of thing. But we can vaccinate for this, and it's another one of those that if you AI, you really don't have to worry about. So that's kind of a nice thing. So I talked about lepto before, and there's kind of 5 main types that infect cattle. And what it ends up doing is attacking and destroying red blood cells, and then attacking the kidneys in the animal. And so if they have this, you're going to see really poor pregnancy rates, which, when we're talking about dairy cattle, teasing out some, our dairy cows are not known for superior fertility, although I think the industry is getting better. But this is one of the things that could be, leading to low conception rates. And sometimes if they get an infection or exposed to it later in pregnancy, we can see them abort those calves kind of later on. Some cows that are infected with this could be infected for their entire life, and be kind of a carrier and shed it in their urine and that sort of thing. And this is something that most of the time, especially in this part of the world, we have a lot of wildlife that are spreading lepto onto our pastures or things like that. And that's how our cattle are becoming infected with it. It's not necessarily because one cow got it and then the rest of the herd got it or something like that. It could be spread by you know, coyotes or, things like that. And that's a little harder to control, but that's why I really tell people that it's really probably important to vaccinate often for lepto. And so that may look like once a year for your adult cows, or some folks even vaccinate twice a year, just to make sure that those cows have a good immunity in their system. Okay. Next disease, I know I'm throwing a lot at you guys, but bovine viral diarrhea, or BVD, is one of those in that kind of combo shot, that is a big problem in the industry, especially in the feedlots and things like that. It's a viral disease and it suppresses the immune system. We often see animals in the feedlot or things like that having diarrhea, which goes with the name, but we also can see it cause abortions in our pregnant cows. And depending on when they're exposed to this virus, it might cause different things from happening. So if they're infected with it or exposed to it after 125 days of pregnancy, that's when we usually see calves abort. But if they're infected somewhere in that 100 to 150, we might see more abnormalities in the calves. So it could be deformities of the head, the eyes, or even the spine, the central nervous system. And that's just because it's causing problems during that organ and organ development period. And then if they're infected during day 40 to 125 of pregnancy, we see what they call PI animals, or persistently infected animals. And so these are the ones that give feedlots a lot of trouble. So if that cow is infected during day 40 to 125, she could produce a calf that sheds that virus their entire life without ever looking sick. So it'd be a carrier animal that could then infect all the other animals they come in contact with. And so these are the animals that we can test for. And that's something I think is important to do, whether it be at weaning or whether it be when you're going to do your pelvic measurements and things like that. I think it's a good idea to go ahead and test for that. And so it's just a ear notch, and then your veterinarian will send it off to the lab. They can test to see, is this calf or this heifer a carrier of this virus? Because if they are, you definitely do not want to keep them around. They will be a problem in your herd. But this is something we can vaccinate for, and should vaccinate for. Another one that kind of goes in with BVD and that combination shot is infectious bovine rhinotracheitis, or IBR. So this is another virus that can be kind of widespread if you don't vaccinate for it. And they can be, cows that have it can be carriers and continue to spread it. and it usually causes like later term abortions. So it's one that, is pretty easy to be controlled through just giving the vaccination. But if you have a herd where you're not vaccinating for this and you're having some abortion issues, this would be something that I would look at. Okay. Listeriosis or listeria. Listeria is the bacteria that causes this. This is one that can cause kind of sporadic abortions, just, maybe one really early, one late, just kind of oddball type abortions. And that cow could have a fever and stop eating before she aborts that calf. This is another one that can be transferred from cattle or other livestock and other animals to people. And this is one that can be passed through raw milk. And if you've ever heard how pregnant women can't or shouldn't eat like deli meats and things like that, it's because of listeria. So listeria is it's a bacteria that thrives. Excuse me, sorry. It's a bacteria that thrives on like refrigerator type temperatures. And so just, cooling that milk doesn't necessarily kill the listeria where it would kill other bacteria. So it's one of those things that could be an issue if you're selling raw milk off the farm or something like that. Okay, so I just thought I would put kind of a little timeline or diagram in here, kind of when to think about things as far as your herd health. And so when we talk about kind of calving up there, our main things are making sure that they get good colostrum, and then think about, okay, do we want to give some sort of scours vaccination or something like that to help prevent scours, which is our main kind of problem at that time. And then, we think about, okay, we've got those calves past, that initial calving and things like that. What about rebreeding those cows? And, then we need to think about, okay, should we give those mature cows kind of their booster vaccination for the IBR, the BVD, PI3, all of the lepto, all of those things. And if you have a bull, maybe need to give, them a booster vaccination as well. Then when we think about breeding, we don't really want to give any vaccinations during the breeding season. And then we move to kind of before weaning. Those calves ought to get that first, maybe those two boosters of our main things, our leptos, our clostridials, and that combo with the BVD and all of that. And then at weaning, we want to make sure, probably honestly, I would say before weaning, you should vaccinate and give that booster, so that you're not hitting them with two stressful events at the same time. Or if you don't hit it before weaning, wait a few weeks after weaning to give that booster so that you're not, causing their immune system to be run down while they're stressed. And of course, then when we kind of come back around to pre-calving on those cows, this is a great time, in that last 3 months or so of pregnancy to figure out, okay, what does her body condition score look like? Do we need to bump up nutrition, or are we in a good spot? And then we can even vaccinate our cows for scours and things like that to kind of help boost that colostrum quality and the immunity through her colostrum for that calf. And so there's kind of different points where we can help kind of manage our herd health overall. And then I just wanted to touch on some kind of basics of biosecurity, which biosecurity could be its own, whole talk on its own. But just some things to think about when you're kind of going through your daily chores and things like that. I think we need to think of kind of two things, and that's to reduce spread of disease within our herd and our farm, and then also reduce the exposure to disease. So reducing our risk of spreading our disease, of course, maintaining clean, dry, sanitary environments, making sure we have a good protocol for cleaning milking equipment and cleaning out our barns and, keeping calf hutches or however you're raising those calves, keeping all of those things as sanitary as possible is going to go a long way. But, trying to reduce manure and things like that getting onto those, the hair coats, especially in the winter when they've got more hair and things like that. So whether that's sand in your barns, whether you're working on a pasture, that might look very different. But manure can be kind of a contamination factor. And so thinking about how we can kind of reduce spreading manure to different places on our farm. We can also separate young animals from our mature animals, and those young animals are the ones that are more susceptible to disease and illness. And so keeping them separate while they develop some immunity is important. Always work, from younger animals, at least when we talk about calves, then go feed your main cow herd or something like that, or go do your milking. But when we talk about calves on their own, you want to go young calves to the older calves as well, because those young calves are the ones that are going to have the poorest immune system. And then the older calves at least have some. And then your adult cow, it's going to, there's a lot of things that her immune system can fight off without problems. You know, taking kind of wasted feed or spilled feed or something like that from, the adult cows, and then using that to feed younger animals like yearlings or, however that might look. That's not really a great plan, just because, like I said, those older animals can be exposed to more things and fight it off without symptoms. Whereas we don't want to bring in disease that those older animals might have or might have been exposed to and infect our younger animals. Another thing to think about is clean boots and clothing. I know I'm terrible at not changing my chore coat in the winter because I have one coat that I really, really love. It's got the right amount of pockets and I like to wear it most of the time. And so because it's cold in the winter, I don't always wash it as often as I should and switch it out. But that means that I could potentially be carrying disease on that coat or on your muck boots or whatever you're wearing. And so thinking about how to keep those sanitary, especially if you have a sick calf or something going on, you definitely want to kind of clean or sanitize as best as you can. And then, of course, if you have sick animals, isolate them. And if you have new animals, isolate them. And, trying to dispose, we do, at some point you will probably have an animal die. Figuring out how to dispose of those dead animals, where your healthy animals are not going to come in contact with that, is also a way to kind of reduce the spread of something going on. Chloe, can you click on to our next slide?
Let's see. Yep. Oh no, too far.
Okay, perfect. And then, the last thing is just reducing your risk of introducing disease to your farm. Some things, especially Stuart, you mentioned you're kind of starting to think about getting into it, buying from good reputable herds with good disease tracking and good biosecurity is important so that you're not going to bring anything in to start out with. Um, and
So is there like a source for that? I mean, like where to buy and what their track record is? I mean, is that
yeah, I'm sure Chloe can get you in contact with some local folks. And depending on what breed you want or kind of what type of cows you're looking for, we try not to rep one person or another, but I'm sure she can give you kind of a few folks that might be good contacts and might have animals that would be a good start to your herd.
yeah.
Um, and sorry, go ahead.
I was just saying, and kind of like back to where you're talking about contaminants or bringing diseases in and keeping things clean. What about ponds? Are they a source of possible disease or you have to look at?
Yeah, I mean we can have some diseases and things in ponds. Lepto is one of those that we see a lot in ponds, and so that comes from the wildlife. That bacteria gets in there, and then our cows go and drink out of the pond, and they could pick it up. So that's one of those that is certainly fairly prevalent when it comes to ponds and things like that. And that's why some people will vaccinate their adult cows even twice a year because they're trying to give them the best shot at being able to fight it off.
Mhm.
But, you know, it also depends on kind of where your pond's at. Are you seeing a lot of manure runoff into your pond, or do your cows have full access where they can go and loaf in the pond and deposit manure directly into the pond? We also see a lot of like mastitis and foot issues because cows are hanging out in the pond when it's hot. So while some farms really need ponds for that water source, if you can provide a water tank or a automatic water or something like that that's clean water that they're less likely to get into, that's probably a better way to do it if that's possible.
Mhm.
Any other questions?
Yeah, I do have a pond on my property, but
And even thinking
Yeah.
like outside of herd health, there are funds, I think it's NRCS will provide funds to fence off any kind of waterways. I'm not sure if that includes ponds, so don't quote me on that. But
mm,
that's
It
one thing that they
does.
advocate for. Okay, awesome.
Yeah, creeks
Mhm.
and ponds.
Perfect.
And so it would give them enough access that they can still use it as a water
Mhm.
source, but not so much that they can hang out in it,
Mhm.
like a
okay.
pool all day.
Yeah,
And
no pool
uh,
parties.
yeah, no pool parties, exactly. Yeah, and NRCS and your local soil and water conservation district have lots of cost share opportunities to help with cross fencing and maybe putting in a well or putting in waters or liming or putting in
Mhm.
clover into your pasture. They've got a lot of programs that can really be helpful in making things a little more affordable to kind of, get some stuff put in on your farm. So I think the other area, we see kind of introduction of diseases if people will go work on somebody else's farm and like, hey, I'm going to go do chores for you. And then they come home and don't clean their boots and don't clean their clothes and things like that. And then they go home and do their chores. And so you could be spreading, or maybe somebody works at the sale barn, or something like that. You could be spreading disease to your own herd. And so, you know, what I try to do is I keep a pair of muck boots that I use for work. And then I have a pair of muck boots that I use at home. And I try not to, bring home anybody else's stuff, if that makes sense. You know, and I think something else that you can do is you can actually post signs for certain areas. Let's say it's, where you keep your calves or something like that, and limit, depending on where your farm is at. Some farms are pretty remote and you're not going to have random people try to, come and pet the calves or something like that. But, everybody sees these cute little dairy calves and want to go mess with them. Well, that could be a potential spread of disease or something like that. So, posting signs might be a good thing if you're closer to town, or if you're on kind of a main road where people might see the calves and be like, oh, let my kid come mess with this calf or something like that. So, that's something to think about as well. And I think the next slide is just my contact information, and a few pictures of my critters on my funny farm down in Howell County. And but if you guys have any other questions, I'm happy to talk, whatever questions you have.
I guess if you are starting out like me, when you start out with like a calf, right? So you just want to make sure that it's been at least tested or vaccinated already, right?
Right. Yeah. And I think it doesn't hurt to give them booster vaccinations if you're unsure of what they've had. But I think if you're buying from a reputable buyer, you should be able to ask those questions and say, hey, what have they been vaccinated for and when were they vaccinated? And that kind of helps. But if you end up buying from like a sale barn or something like that, where you don't get to have that face-to-face conversation, I would err on the side of assuming they haven't had it, because if you give them that extra booster, it won't hurt them. It will just help their body have a little more boost in immunity. So, I mean, I think that's the way that I would approach it, is give them a better shot than assume they've had it if you're not able to have that conversation.
And on top of that, I'm always an advocate for getting your vet involved. If it is something that you're buying off of a private farm and you do have a good conversation, that person should also be receptive to you saying, hey, I would like to bring my vet, just as a double check measure. If they're
Yeah,
very confident in their health plans and their cattle management, that shouldn't be a big deal whatsoever, just to have a second confirmation by your vet.
absolutely. Yeah.
Well, again, feel free to send any more questions in the chat. Here's our contact information. Mine will be at the end. Send all your questions to us. We are happy to help. Oh, someone typed in, actually, mostly for multi-species grazing systems, how would you prevent the transfer of diseases through different species or other things that need to be considered? So talking about possibly like sheep and cattle.
Yeah. From the side of like parasites, multi-species grazing can actually be a benefit for that, because sheep parasites are not going to infect cattle and vice versa, or goats and horses, or whatever different species. They have specific parasites that are going to infect that species. So multi-species, whether it's two classes of animals together in one field, that can be helpful, or even just like a leader follower system where one grazes first and the other ones come behind. either way, that other species can act as kind of a vacuum for parasites. So, one that works really well is cattle and goats. They like to eat different species of forages too. And so if you've got a lot of brush on your farm, goats will favor that, and then the cows will eat the grass. And so those work really well together. And then the cows will act as a vacuum for the goat parasites and help keep those goats healthy. And so on the parasite side, multi-species grazing can really be a benefit, right? When we think about like leptospirosis and listeria and some of those things, we can see that in sheep and goats and cattle. And so, that sort of thing, that's going to be something that you have to manage, from the vaccination side and from the environment, trying to rotate those pastures and try to keep them fresh if you can, because if they have time to like right now, get lots of sunlight, we see some of those pastures start to break down not only parasites but bacteria and things like that. Whereas if it's really warm and moist, and we've had a lot of rain, but some of those months where it's just like May is a time where it's warm, but it's also we're getting a lot of rain. That can kind of be a breeding ground for certain bacteria. But we do see, if you lime your pastures, based on whether they need it, if off of a soil test, lime actually has some antibacterial properties, and so potentially liming your pastures could help kind of get rid of some of any diseases and things like that, that might be going on out in your pastures. But there's just some things like with the lepto that we have to just be really diligent about vaccinating, just knowing that we're going to have lots of wildlife that could spread it, to our farm. So I don't know if that answers your question very well, or if you want to unmute and ask more questions, that's fine too.
Oh, they said it did. Thank you. Awesome. Yeah, that's a good question because a lot of people, especially smaller herds, have interest in kind of utilizing as much as they can. And that's a great way to do it too.
Right. Yeah. And most kind of profitable farms, especially when we talk about smaller farms, they're gonna benefit from being able to use multiple species. And so like I really like, goats and cows or goats and horses together if you have like brush like blackberry or multiflora rose or things like that. But even some of our kind of broadleaf weedy type things, sheep are great at eating those. And so that can work really well with our cows that want to eat 80% grass, and so I really like the multi-species grazing kind of setup for most people.
Well, thank you so much, Elizabeth, for sharing all of your expertise with us. You were the perfect person to come and talk about health and all things cattle with us today. But we'll keep moving on. I know we're a little bit over time, so I'll try to make it a little bit quicker. So just a little bit more about mastitis, since that is one of the most prevalent diseases in dairy. So this one is actually, again, caused by bacteria, but it can also be caused by an injury to the udder, either by heat or by physical force. So having that inflammation in the udder can really start to cause problems. So the one thing you want to look out for, the first symptom is usually swelling and then feeling hot to the touch. Other symptoms, when that case progresses, can look like reduced milk production or even reduced feed intake. Maybe looking a little bit dehydrated, they don't move around as much, and their eyes may look a bit sunken in. So again, kind of just the swelling and the heat would be first, but then in a more progressive case, you can see the rest of those symptoms. The main cause, though, even besides injury, is just poor hygiene. So you can see when you milk, we do a post-tip a post-dip treatment to that teat, because once the milk comes out, that teat canal stays open for a little bit. So we want to make sure we're disinfecting that first and giving that time to kind of constrict back down. So the other problem before that teat has time to constrict is exposing it to bacteria. So if she goes straight from the parlor back to her area to bed down, that could be a cause of infection. So what do we do to prevent it? So just basic good hygiene for cows. So again, your parlor practices like your post-dip treatment, and then just making sure your equipment is clean, your area is clean, your hands are clean, wear some gloves, anything and everything to just make that environment more sanitary is crucial. Then you can also reduce the chance of infection, again, by making her bedding clean. So if you have everybody up to go milk, have somebody go ahead and clean out that bedding area, or just make sure that everything's clean, nothing is very covered in manure, or just add some fresh bedding on top. And then a good way to kind of evaluate where you're at on your farm management, you can just do a couple easy steps. First, just analyze your current protocols and your environment. If you're noticing that, maybe we're not paying enough attention to washing our equipment, note that, and then make a plan of action on how you're going to address it, and then implement and evaluate. So just by making simple little changes, maybe you're wearing gloves while you milk now, or maybe you clean your milking equipment before and after instead of just after. Those little things can really do a lot to help your herd health. So again, this is my information. We didn't go too deep into all the weeds today, even though it was a lot of different diseases. Some of those go very, very, very in depth. And if you have questions about those, want to know more about a certain subject, please send us a question, send us an email, give us a call. That's what we're here for. So our next session will be in September. It is on September 9th. And we're going to talk more about budgeting for your herd. So kind of thinking all the financial pieces that you'll need in place to get started. So again, if you have any questions, go ahead and unmute and we can chat for a bit, but I'm going to go ahead and stop the recording.